who have, sounds like like-minded interests of sort of helping our community, particularly our seniors, through this really difficult, isolating time. So just a little bit about my practice. We opened up about a year ago. It's called Transformation Health and Wellness. We're here in Anaheim Hills off of Canyon Rim and Knoll Ranch, so about a mile away from Canyon High School. We specialize, it's a concierge medical practice or direct patient care model where I'm able to actually directly take care of patients one-on-one as opposed to going through insurance companies and waiting for referrals and that sort of thing. So I'm actually able to spend quite a bit of time with my patients, anywhere from 30 minutes to an hour at any given visit. We can see them for a variety of things, anything from flus, coughs, colds, to hypertension management, anxiety, depression. We deal with memory issues. I have a couple of patients with neurological issues such as ALS, chronic Lyme disease. So we're a little bit of a complementary type of practice or integrative practice where we combine both Western medical approach along with more of a non-traditional approach. So we combine therapies to get patients their best overall care. So without further ado, we also, I just was going to walk through with a patient, a mock patient, so to speak, one of my voluntary staff members who gets paid to be my guinea pig. But with that, we're able to do COVID testing here at our practice. Again, we tend to be able to be a little bit more adaptable and lenient in our criterion for that testing. I know a lot of patients have expressed frustration because through the conventional medical process, they're not able to get the testing that they feel is necessary. And I think particularly as we have family members who are dealing with our senior population and they're going to work, they're going to and from, they're dealing with our kids who tend to be petri dishes. And then they're dealing with their senior parents or aunties and that sort, they may not be sure that their loved ones are being safe and protected because they themselves aren't able to get tested. So we're able to do that here in the office. We are also able to do COVID screening at the curbside. If somebody does have an active fever or other active symptoms, we're able to accommodate them. We do have our own supply of PPE, so we're able to protect ourselves in that manner and make sure to get the best care to our patients. So Ken, you want to come on over? So just a kind of demonstration of what we do. This is Ken. Ta-da. He is not sick. He's been doing very well through this whole crisis. And so he has an allergic cough, so he's always with allergies. So he sounds sick, but he's actually not. It's his baseline. But that being said, when we have our patients come in, we make sure to do a full assessment. We get their vital signs, document fever, document oxygen saturation, which is really important. I've actually just taken care of 2 babies this last week, both of whom had viral pneumonias and were sitting in the high 80s, low 90s. So very concerning, but fortunately we were able to keep them out of that hospital setting from having to go in and be admitted by just being able to manage them here. So we would get his vital signs, be able to look in his ear, nose, throat. Again, very important that we're able to do a full assessment, a full physical examination, because there are still other processes going on this planet than just COVID. I know that that's been the big focus, but we have diagnosed influenza. I just diagnosed strep throat last week. So there are other things that we also screen for. So then of course we listen to heart and lungs, making sure to listen in all 6 areas of the lungs, that we don't have any pneumonia kind of preemptively kind of trying to sneak in there. And then we're able to do the actual COVID testing. So I don't know if anybody has seen the COVID testing. I know a couple of offices were saying that they offer the COVID screening, so I'm sure you've seen it. But it's a little small vial like this with a liquid medium. I don't know if you can see that or appreciate that. This is called a UTM medium, is what you would be looking for if you're having it in your own offices or practices. And then there's a little what's called flocked swab, and that flocked swab looks like a Q-tip, but at the end it's very, very narrow, and it has like a little fuzzy nature to it. So that's what we would use to go back through the nasal passage. So just look, he's so nervous. He's so cute.
You didn't tell me I was going to do this.
But it's a little different than just going straight inside up into the nostril. It actually goes straight back through the sinuses, so right at this angle until it stops. So it actually stops at the top of the nasopharynx, and it almost makes somebody feel like they want to cough or kind of snuff it out of there. We want to go in directly, and we want to wait for 5 seconds. twist and come out, and then we want to go onto the other side as well, and then twist and come out. So that's going to be the correct way of doing this swab. Woo, he's like wiping his brow because I didn't actually do it for him. That being said, then we send that off to the lab. There's a variety of labs we work with. We work with Quest and LabCorp primarily. They're obviously the larger entities that will cover this through insurance typically. However, I have a number of patients who either are going outside of their insurance because they may have Kaiser, they may have some form of MediShare. So there's a great lab that we work with called Westpac Labs. They will actually typically get me my results back within about 24 to 36 hours. So actually much faster than those results that we're even seeing in the hospital setting or that Quest or LabCorp can guarantee for us. Typically they're taking about 5 days or so. So dealing with the smaller private lab, one, support small business, yay, everybody else out there, small business, but then also helps to get our patients that answer much, much sooner. I actually just had a patient yesterday get rescreened. He was negative initially, still wasn't feeling on his A game, but we did his COVID screening yesterday, and just this morning I opened up my computer files and it's already there. So really remarkable turnaround for our patients. Great. Just a quick reminder with the RT-PCR, which is what the screening is. It's a PCR testing for the viral RNA. It can actually be falsely negative about 30% of the time. So something to remember that even if you have a patient who has screened negative, but they're demonstrating symptoms, you want to really treat them as if they're positive, because this test, even though it's kind of morphed and gone through a couple of generations, is still kind of a poor test in that 1 in 3 people that test negative is actually positive. So we want to be really cautious about that. Is there anything else, Kyle, that I can share with you guys?
I can imagine there's a lot of questions from everyone in the group right now. I'm still kind of in shock. I guess I do have a question, although. What
Certainly.
would constitute an actual test? Do you have to have one of the symptoms, all the symptoms? And if so, what could be some of the symptoms you wouldn't normally think of?
Yes, so the traditional symptoms that we're going to be looking for, Ken's running away as fast as he can. One of the symptoms that or the constellation of symptoms is fever, cough, and shortness of breath. So those are kind of the triad of COVID-19 that we've been most concerned about. That being said, I'm sort of screening anybody for any reason. I had 2 young ladies who'd been exposed at work with a work exposure. Their manager had tested positive. They shut down the store, but then they were of course very concerned because they live with their 90-year-old auntie. So in that instance, because they'd had a known exposure, then even without symptoms, I was able to go ahead and test them. Other symptoms that have been kind of coming to the forefront, and it's sort of controversial as far as I'm concerned, is the loss of smell, loss of taste. The reason why I consider it a little controversial is anybody who's ever had a cold knows that those can be very, very common symptoms. So whether or not it's COVID specific or just I have a viral funk, it's always hard to say, but certainly if you're feeling some of that, nausea, vomiting, diarrhea can also be associated with COVID, but again, with kind of any viral syndrome. So if anybody's coming in with those symptoms, I'm happy to screen them as well.
Okay, very cool. And now the questions are coming in now. Looks like first question is from Verdi Villejas.
Yes.
Yeah, hi. So just a quick question for you. So what throws off a test? Is it on the procedure itself in trying to take a sample, or is it on the testing reagents that are using when it goes back to the lab?
As far as why it sucks? Sorry. It's hard to say. I mean, certainly nobody has come into my office ever and actually trained me or my staff in how to do it. So there may be a fair amount of people who just are not well adept at how to do the test. I know initially I thought it's just you go straight inside the nostril, you take a little swipe and you send it off. And later in studying and reviewing everything, it's like, nope, it goes straight back all the way to that oral nasopharynx. But that being said, then I think just the PCR screening itself, whether they're not able to amplify those viral particles or find that mRNA, it's hard to say exactly why it's a terrible test, and I haven't seen much come out in the literature yet as far as how they're planning to improve it. It's a little frustrating from a scientist standpoint because certainly we want a better test and they're coming out with faster and faster results, right? Oh, you can do this in your office, you can know in 5 minutes, you can know at home, that's great, but if the fundamental foundational test is not a great test, then I don't know that those faster, newer, later, greater tests are going to be really any better, other than just being faster for still kind of a not reliable result.
So if you take the test once and it becomes a false negative, let's just say,
Yeah.
then you have to get swabbed again.
Again, yes. Yeah, that's how it goes. And I know that there was a recent actor, I believe, who was just kind of getting worse and worse and worse, and he screened negative twice, and then on the third finally tested positive. And at that point, I think he was already getting hospitalized, and I don't know whether or not he needed ventilator or not, but certainly getting worse and worse. So it's my philosophy to sort of like jump on it a lot faster, and really prevent that inflammatory cytokine response from taking hold and advancing. So like get on it early, treat it as if everybody is positive, and then we sort it out on the back end later. If it comes out negative, great, I'm all the happier, but at least we're well on our way to treating whatever kind of virus they have.
So if you take a sample on the left and it tests negative, then you go on the right and take another sample?
I actually do both. I do both regardless. Yeah, so I go one side, spin, go back on the other side, let people kind of breathe in between, because it is not a very fun test at all. And then I make sure to hand them the address where they can do the Yelp review.